Welcome to RN Mindset Prep. Today, we're going to look at how to recognize and respond to rhabdomyolysis in a crush injury patient. A 34-year-old construction worker is admitted after being pulled from a collapsed structure. His vitals are stable, his legs look normal, and he says he feels okay. 6 hours later, his urine turns dark brown like cola, and his creatinine is climbing fast. Something is happening inside. This is rhabdomyolysis. Crushed muscle fibers release myoglobin into the bloodstream, and myoglobin clogs the kidney's filtering tubes. The kidneys begin to fail from the inside out, even when the patient looks fine on the outside. Here is your first question. The nurse notes the dark urine and rising creatinine. What is the priority nursing action? Option A, restrict the patient's fluid intake to prevent fluid overload. Option B, prepare the patient for immediate dialysis. Option C, administer aggressive intravenous fluid resuscitation as ordered. Option D, apply a urinary catheter and send a routine urinalysis. Let's break this down. Option A is incorrect and actually dangerous here. Restricting fluids in rhabdomyolysis worsens kidney damage. The goal is to flush myoglobin out of the tubules, and that requires high fluid volume, not less. Option B is incorrect as a priority action. Dialysis may become necessary if kidney failure progresses, but it is not the first response. The nurse does not jump to dialysis before attempting fluid management. Option D is partially appropriate, but not the priority. A urinalysis can support the diagnosis, but placing a catheter and sending routine labs does not address the urgent threat to the kidneys right now. The correct answer is option C. Administer aggressive intravenous fluid resuscitation as ordered. High-volume intravenous fluids dilute the myoglobin in the bloodstream and increase urine output, which physically flushes the toxin through the renal tubules before permanent damage sets in. This is a nurse-initiated, provider-ordered action that directly addresses the root cause of the kidney injury. Now here is your second scenario. The same patient's potassium level comes back at 6.2 milliequivalents per liter. He is on continuous cardiac monitoring. The nurse sees peaked T waves on the rhythm strip. What should the nurse do first? Option A, recheck the potassium level in 4 hours per routine protocol. Option B, notify the healthcare provider immediately and prepare for treatment. Option C, encourage the patient to eat a low potassium meal to balance his levels. Option D, increase the intravenous fluid rate independently without a new order. Let's work through this. Option A is incorrect. A potassium of 6.2 with cardiac changes is an emergency. Waiting 4 hours is not safe and does not meet NCLEX standards for recognizing a life-threatening situation. Option C is incorrect and does not make clinical sense. Food choices do not correct a dangerous potassium level fast enough, and this response ignores the cardiac changes on the monitor. Option D is incorrect. Increasing the fluid rate without an order falls outside the nurse's independent scope of practice. Even in an emergency, the nurse escalates to the provider rather than changing ordered treatments unilaterally. The correct answer is option B. Notify the healthcare provider immediately and prepare for treatment. Peaked T waves with a potassium above 6.0 signals hyperkalemia with cardiac involvement. This is a true emergency. The nurse's role is to recognize the pattern, escalate immediately, and be ready to carry out treatment such as calcium, gluconate, sodium bicarbonate, or other ordered interventions. Acting fast here can prevent a fatal arrhythmia. The big takeaway from this case is that rhabdomyolysis layers multiple emergencies together. Dark urine and rising creatinine tell you the kidneys are in danger. Peaked T waves and high potassium tell you the heart is at risk. The NCLEX expects you to recognize both and act in the right order. Always treat the most immediate threat to life first, and never delay escalation when cardiac signs appear. See you next time on RN Mindset Prep.